Hello, my name is Dr. Caroline Guerrero Cauqui. I am the chair of the Fellowship Committee for the International Academy of Orthokeratology and Myopia Control. In this video, I'm going to give you the steps on how to prepare your cases for the oral panel exam as one of the steps in attaining your fellowship. And the point of this is that we want you to prepare these very well in advance so that we will be amazed by your brilliance and your preparation, and so that when we go to ask you questions, we won't be asking you questions about something that was missing from this, but instead be able to tell us how brilliant you are. Here's the protocol. You submit an abstract, you receive approval from your reviewer, and then you go through a mock presentation, and then you are provided with extensive feedback. If you pass that, you then go on and submit the abstracts for cases 2 and 3. If those are accepted, then you submit cases 2 and 3. Now, your reviewer's role will be to provide you guidance on case 1, extensive guidance on how to prepare it, what kind of cases are good, what kind don't qualify, answer questions for you, and then also conduct a mock practice presentation. They will also review cases 2 and 3. You start out submitting an abstract of the particular case that you've chosen. And the purpose of that is because we don't want you to spend a lot of time preparing a case that turns out to be way too simple and just didn't qualify. And so if you can submit an abstract in advance, your reviewer will look at it, give you feedback on whether it qualifies, and if it does, then go ahead and submit it. And if it doesn't, find a new case and keep submitting until you get one approved, but it has to be by the deadline, and you will be given a deadline to complete everything. Now, I don't want you to think that we reject all sorts of cases, because most of the time we accept them. It's just that we don't take slam dunk cases that are done in one and they're very simple routine cases. After you have submitted and had case 1 completely approved by your reviewer, then you're going to submit cases 2 and 3. It's an abstract. Your reviewer will look them over, and then if they are of passing quality, then he'll say go, or she'll say go ahead and prepare cases 2 and 3. You submit them, but you're not going to get a lot of feedback on cases 2 and 3 because feedback came from case 1. That was the practice. Case 2, they'll tell you, hey, you know what? This just isn't going to make it on the presentation, so you really have to give me a better case or prepare it better. But they're not going to tell you how. That came from the first, and what we hope you will learn from the first is how to do it for the second and third. So why do we ask you to use a case template? Well, we've been doing this for a lot of years, and we finally come up with a PowerPoint template instead of a Word document. And that's because in Word documents, things don't stay in place. So you might put a topography on page 1 and it flies over to page 4. Or you'll have some bit of data that just gets misplaced. And if we have a PowerPoint, you can drop the data into each page and it doesn't go anywhere. It stays there. Now, this is particularly important because your reviewers have to be able to go through this group and make sense of it and not get confused. And by having everything fall into place, it really helps. Plus, also, it helps you remember, don't forget to put this and that, and otherwise your presentation wouldn't be complete. And there's a different set of PowerPoint pages depending on the type of lens that you are going to submit: trial, empirical, custom design, combination, whatever. So our case requirements, they have to be, as I said, interesting and complex. Because if you do like a -3 case that was done in one lens, what does that show? It shows you know how to fit an ortho-K lens, but Are you really a fellowship quality, or are you just a basic one? I sort of think of it like a hamburger. If you get a hamburger at McDonald's, it's a basic hamburger. If you get one at a fancy restaurant, it's got all sorts of things on it. It's more complex, it's more delicious, it's more interesting. That's what we're looking for. So let's say your case just doesn't fit into one of those categories on the previous page. That's okay. Submit the details of your case on an abstract and submit it to your reviewer. And if it's interesting, it'll probably qualify. Feel free to think outside the box and come up with something that we just haven't thought about. So, we want you to use the case template. If any data are missing, tell us why, because it's really important that you tell us why. Otherwise, we're going to think, you know what, this doctor just doesn't know how to do the follow-up. They don't have any of the information. It could be that the patient just didn't come in for that visit and you tried to get them in, but they didn't come in. And so more is better. Explain more rather than less. In explanations for the maps, for the sodium fluorescein videos or JPEGs, explain about it so that we don't have to wonder that you know what you're talking about. And make sure the data makes sense. So, if you say the patient's uncorrected vision was 20/20 on day 10, but the RX that you get is minus 150, that doesn't make sense. So go through it and make sure everything makes good sense so that you can demonstrate how smart you are. I'm going to ask you for some pre-treatment data listed right here. And we're going to ask you for topography, and you have to tell us, why did you choose these maps to show us? Why didn't you choose other maps? Why did you pick this? And look at the maps and describe what data you're looking at pre-treatment, and give us a good representation that you know what you're doing when it comes to topography and topographic map assessments. Then you come to the summary, and this is super important because what you want to do is explain why you thought this particular case was complex or interesting, and what were the concerns when you started off. Why did you take on the case? And if you can make a really good argument here for why this is complex, that's going to go a long way toward passing that particular case. Then you come to the summary, and this is super important because what you want to do is explain why you thought this particular case was complex or interesting, and what were the concerns when you started off. Why did you take on the case? And if you can make a really good argument here for why this is complex, that's going to go a long way toward passing that particular case. You can see right here, this is a portion of the template for the pre-treatment data and how you stick it in all the little holes so that they stay in place and you don't forget that you're supposed to include something. Now we come to the portion where you are going to describe your fitting. And you may use trial lens, empirical fitting, or you may do a custom design. And the template allows for each of these 3 different ones in different sections. And so first, if you're doing trial lens or empirical, you're going to tell us, how did you select your first lens? And then you're going to put the lens on the eye, show us videos or photos, describe what you see, assess the fit. And then if you don't think this is appropriate, and probably it won't be appropriate, or if it is, we're going to want to see other lenses as well, because it would be crazy to just show us one lens and say this is the one I'm going to use, and then go on to show us the second and the third lens. Now if it's a custom lens, of course you're going to custom design it and tell us how you chose those particular parameters, and then after that lens is made, you'll put it on the eye and describe the fitting characteristics of that particular lens. And you can see here are the templates for diagnostic fittings for, this would be a trial lens. And then this page is for fully modifiable. And what we really want from a fully modifiable is that you enter the lens parameters or give a screenshot so that we can see exactly what the curves were that you selected. Remember, when you are showing patient information, make sure you remove all the patient identifiers. Just use ID numbers, but don't use the patient's name. Now, when you get to the follow-up, you want to provide the data for each follow-up visit. And a typical follow-up is 1 day, 1 week, 1 month, 3 months. Remember, if any of the visits are missing, explain why. So in presenting those, identify the visit, because you have no idea how confusing it is for one of the case reviewers to look at the case, and when we get down to maybe the second or third lens change, we don't even know what day it is anymore. We're so confused, and it's kind of hard to go back and forth in the different slides. And so if you label this day 1 with the date and the lens number, it's so much easier. Or 1 month with lens number 3, this is the date. If we have to go back and forth and try and figure out where we are, you're going to find that the reviewer just doesn't, they won't do it, and they'll reject the case. It's got to be orderly and easy for us to follow. And you're going to enter the parameters and the lens number, and then of course all of the information here. Usual wearing time means, how many hours a night do they sleep, and then wearing time today means how many hours did they sleep with it that night, the night before you saw them. That's always useful information. And then what are the acuities with and without the lenses. And then on the first visits, of course, you're going to want to show us some videos of fluorescein if that's at all possible. If you select a case that you did a year or 2 ago and you don't have video for it, but you think it's a fabulous case, okay, but we really need fluorescein to really give you the best analysis and presentation. Of course, the topographic maps are also super important, and what you want to do is make sure that you select the appropriate maps for demonstrating change and defend why you've chosen them, and then discuss what you're looking at. What do these data mean? How is the treatment progressing? And then you can see right here we have the nice little slides from the PowerPoint where you're going to drop in your data and your analysis. And there's 4 of them here. You can look at them very carefully. They're looking for the design parameters, and then you can put your maps there right in the little squares, your analysis. You'll type that in. Now we get to troubleshooting. What you want to do is describe the problem and then be very specific about how you're going to fix it. You're going to show the parameters of the new lens and then also the old lens so we can go back and forth and look to see what is it that they changed. And if you don't do that, we have to zip back up to the old lens, and that's a little bit confusing because we have to go, okay, let's see, the diameter was this on the old lens, here on the new lens. Put them together so we can really see. Remember, in the proprietary designs, you're not going to know what the actual curves and diameters are necessarily. Maybe the overall diameter, but not the diameter of each of the individual curvatures. And that is, it's a problem for us, but what we've done is just said, what you're going to do is say, what would it be? What are the changes you would make if you were making the changes? You're going to tell us what lens you're ordering and how you ordered it and how you came upon that idea. But if you were the proprietor of this lens, the manufacturer of this lens, what is it that you would have changed to change this fit on the lens? To say that you called up the manufacturer, told them the problem, and they told you what to do, that's probably not a really good thing to tell us, because that doesn't show fellowship quality. But if you actually called up the manufacturer and ordered a different lens based on your experience, but said why you chose that particular lens and what you anticipated was different about the lens you chose compared to your other lens in terms of how it fits, that's what we're looking for. And of course, use the template to supply the data that we need to assess the fit and the outcome of this. And then when you get to the final visit, what you sit here and you say, okay, in retrospect, did you handle all the original challenges that you told us you had? And what sort of lens changes did you make, and how did it affect the outcome? Sort of just give us a nice recap. Could you have done more? If it wasn't perfect, why didn't you continue? And that's not a problem if you want to stop and the vision wasn't 20/20. Just discuss why you chose to stop and how the patient felt about it. What might you have done differently, and what did you learn from the case? So there you have it. You have a good fit, good vision, happy patient, you're done, the case is done. The takeaway from this video is that you've got to choose a good case, an interesting case. You've got to provide us data that makes sense and is presented in an orderly fashion so that we can follow your thinking, try to explain everything you've done in advance so we don't have tons and tons of questions, and make it nice and clean. Happy preparing, and in the next video I will describe to you how you actually use these cases when you are engaged in the mentor-led exam and the oral panel exam.